Hello, my name is Marge Benham-Hutchins, and I will be providing this lecture on an overview of nursing informatics, emergence of a discipline.
I often get a question in what is informatics? Informatics is basically a science of information. It has to do with information processing, information systems and the design, and then the application and social consequences of the technology. It also includes the art, science, and human dimensions of information technology and the study, application, and social consequences, and also the application of information technology to arts, sciences, and professions. Now that definition is from Wikipedia, and it's pretty broad, but what's really important for you to know is that informatics is not computers. Informatics is managing information, and for nursing that is of specific importance. Medical informatics is involved with the acquisition, the storage, and use of information that is necessary for medical practice. This includes information needed for decision making, cognitive tasks, communication between various members in the medical practice, education purposes, and also for research. As nursing informatics emerged, there have been many changing definitions. One of the early definitions from 1985 looked at it as the use of information technologies in relation to any of the functions that are within the purview of nursing practice, that are carried out by nurses and the performance of their duties, and anything to do with care of patients, administration, education, and research. It's a very broad definition. Later in the 1990s, we started to see a focus on multidisciplinary scientific endeavor, basically recognizing that the information used by nursing is not just nursing data, that we use information from other specialties also. And also that we needed to be able to analyze and model a lot of that data in order to develop knowledge-based decisions about patient care, and use it to develop knowledge, nursing knowledge, and also to examine closer the quality of care. In 1998, the American Medical Informatics Association Nursing Information Working Group came up with a very short and precise definition and basically identified nursing informatics as the integration of nursing, its information, and information management, including the information processing, communication technology to support the health of people worldwide. The American Nurses Association's scope of standards of nursing practice built on this definition, and in 2008 they identified nursing informatics as a specialty, and you can get a certification in nursing informatics, and that it integrates nursing science, computer science, information science to manage and communicate the data, information, knowledge, and wisdom in nursing practice. Nursing informatics has identified four main concepts, what they call metastructures, that make up nursing informatics. You start at a very low level and you start with data. This is very objective, it's very discrete, it's an individual entity. The next higher level is information. That's when you take data and it's interpreted, it's structured, it's organized. The next step is knowledge, and that's where our formal relationships between the data and knowledge are. And then wisdom, and that's the appropriate use of the knowledge to manage and solve human problems. So an example would be vital signs. A data would be a single discrete temperature, blood pressure. When you take a bunch of those vital signs together and you place them in the context and you start to compare them. So what's normal for this patient? What do vital signs, elevated blood pressure, temperature, what do these mean in the bigger picture? We start to pull them together. And then this goes into knowledge, where we take our knowledge and our education and our experience and we combine it with that particular information, and that will result in an action or intervention. And then on the highest level is when we take a knowledge base across multiple patients, and you include a variety of different options, and you use your nursing wisdom, your experience, and you use this in order to determine what is most appropriate for that specific patient in that particular situation. One of the things that I'm very interested in is that we seem to leave out in this definition the art, science, and human dimensions of the technology, and the study, application, and social consequences. And how do we incorporate these factors into our study and application of informatics? For example, I'm very interested in the socio-technical aspects of information technology. And when you put information technology into a healthcare facility, how does that influence the communication processes between providers as they share or as a team works and provides care along the continuum? Human-computer interaction is one area where some of the socio-technical aspects of technology come into play. One is ergonomics, and that is the actual interface and how we interact with the computer, whether we use a mouse or whether we use a touchpad, the design, and that actual interaction with the technology. Usability has to do with how usable is it? Does it really fit our workflow? And many times nurses complain that the designers of the systems were not aware of how they do their job and may have a very linear way of charting, or it's not flexible, or it doesn't take into consideration the episodic characteristics of nursing practice, where we may be doing something and then go back and continue it, that we're caring for multiple patients at the same time, and we're not necessarily going to be able to finish a linear assessment. We may do parts of it at different times and such. And this brings into consideration these other socio-technical issues, and that's how does the technology fit with our workflow? How does it include communication? We'll be talking a little bit about standardized language. How do you collect the information and so it can be aggregated in a way that makes sense? The organizational culture. This has a huge factor in terms of acceptance and the type of technology you're putting in. Decision making concerning the actual technology. Hierarchy. Who makes the decisions? Power, autonomy, control, all of these things make a big difference in not only the selection and design, but also the success of the technology implementation. We would be remiss if we didn't recognize the general technological revolution that's influencing the use of technology and also the growth of technology. Personal computers today, they're going down in price. They're more and more powerful. More and more people are using internet. I just recently had an invitation from a 93-year-old friend of mine to become a Facebook friend of hers. Wireless technology, we're very accustomed to our cell phones, using wireless computers, Bluetooth. More and more people are computer literate, which is where a lot of the initial focus was in healthcare, is to teach people to use computers. But now we're really looking more at information literacy. Our global economy is also including electronic information exchange. We can contact people, we can talk to people in all areas of the world and exchange information and compare ideas. And then, of course, technology has been integrated into business and specific banking and travel. We go online and get our airline tickets. Banking, we have all our transactions. The days when you went in with your paper account book and they wrote in that what you did, or you had a paper statement. A lot of people don't use checks anymore. They use debit cards. A lot of these things have really changed, and it's changed the expectations of our patients in terms of the type of technology they expect in a healthcare environment and the type of service or communication, such as email or 24/7 accessibility to their physicians or their healthcare. And of course, there's a lot of government initiatives right now in order to bring more technology into the healthcare environment with the idea of reducing costs and improving continuity of care, reducing medical error. And we'll be touching on some of those different topics as we go on in the course. A little bit of history here. Electronic records are one of the things that are being used in acute care facilities, with the idea that we'll have continuity of care and that those same records will be available in a variety of different settings. Going back and looking at early documentation systems, we initially, of course, had a paper record, and it recorded observation. It served as a reminder. There weren't necessarily a lot of bureaucratic requirements, and it usually was done to meet the needs of a particular clinician, and the physician would be going back and looking at their own records in order to keep track. Well, as patient care increased in complexity, we had more providers. Patients are more mobile. There's many treatment options, and of course the insurance, government, accreditation agency requirements. All of these resulted in very complex paper documentation systems. The first clinical information systems actually came about. One of the first ones was in 1960s, in 1968 in Mass General. They were used for acute care. The introduction of managed care influenced the need to have clinical information systems because they needed to share patient information between providers. They needed a continuity of care, and they needed a computerized patient record in order to keep track of these things. Another important component of an electronic health record in health information technology is decision support, is using that data to support care. And that could be standards of care, evidence-based practice, research dissemination to get that information out, medication management, things such as compatibility, allergies, prescription guidelines for particular diagnoses, renal, hepatic insufficiencies in particular, identifying those patients for prescriptions and medication dosaging. Things such as monitoring coordination of multiple comorbid conditions and multiple therapies at the same time and maybe different providers. Patient preferences, such as being aware of things like advance directive and what that patient really wants. And then also surveillance. This has become a major thing right now, is monitoring for disease and symptom clusters. And this could be population wide. This could be on a acute care setting. You could be monitoring for infection control purposes, or you might actually be monitoring for a particular patient and use surveillance to determine that there are a variety of factors present that makes this patient more at risk for maybe falls while they're in the hospital or for a particular disease process. Some of the drivers of the health informatics revolution are the Institute of Medicine reports and others, such as To Err is Human and the push to develop safer systems in health information technology viewed as a way to reduce medical error. The National Health Information Infrastructure is the national plan in order to put in a health information infrastructure, and that includes electronic health record adoption and the diffusion, seamless patient care between physicians, informed consumer choice, and public health reporting are four major parts of that particular initiative. Nursing's role in this process is very important. Your 3 articles assigned for this first nursing informatics overview component of Module 1 have different ways that nursing can get involved with this, and how important it is for nursing to get involved on all levels. A lot of it has to do with research management. There's analysts, health literacy issues with patients, reaching nursing's goals, patient safety, coordination of care, evaluation outcomes, and research-based or evidence-based practice are goals of nursing that are supported by informatics. And nurses also play a very important role with the health informatic technology and system design, the development, selections. Nurses are great project managers. They're involved with implementation. They greatly influence adoption. And then one of the most important roles is evaluation, when these systems come in to give feedback to continue with the growth and development and to make the systems better.
This concludes the lecture on Nursing Informatics, Emergence of a Discipline. This list provides a few resources for you for further study. I've provided Wikipedia because it is a source of information that is updated on a regular basis. It is a starting point for research in this area, and the pages on informatics happen to be quite good. So I recommend you could go there and you can look and you can see a lot of different resources. And then, as always with Wikipedia, you should go to the primary sources to verify the information.